have to go like this because this is the in sync.
Okay.
Sorry about the
like
sweatiness.
Me too. Well, it's like the camera. It's like it makes it come out. It's fun.
Okay, so this is Dr. Nate Tschudy, founder of Southwest Integrative Medical Associates, and he is my new primary care physician. And I was fascinated by the model, the convenience, everything about it. I can't remember the name of my other primary care physician. I don't even know if I have ever truly had one. No, I have had one, but I just, on forms, I can never remember who it is. It's like not the biggest importance to me. Going to the doctor is not the most fun or enjoyable experience. So I found Dr. Nate and I'm so thrilled. So tell me about your practice.
Really appreciate the intro, Kim. So Southwest Integrative Medical Associates, we're what's called a direct primary care practice. So direct primary care, that's not a novel term to me. We didn't come up with that, but it basically represents a more direct relationship between the patient and the provider and less of a relationship with the third party, aka insurance, making the decisions for me or you.
Which means I do not go to his office. He comes to my home, looked in my fridge, sat at my table.
Right.
And I didn't even have to get dressed or go in the car or anything like that. And I didn't miss my appointment because he came to me.
So the fun part about direct primary care is just making healthcare really straightforward for a change. Usually, and Kim can attest to this, our new patient appointment was roughly 60 minutes. So I really take time to get to know your health history, what's going on, and what are your health goals. And I think the last one is a huge thing that a lot of people breeze over. Well, you're coming here with a problem. Some people don't have a problem. Some people just have a goal of something they want to work on. So I believe that a lot of the importance is in the history taking and getting to know my patients in a professional way. Follow-ups are usually about 45 minutes because I really want to make sure that what we're doing is making that impact. Mm-hmm. You brought up insurance and I brought up insurance. So the interesting thing is with direct primary care, you would pay us directly. If you do have insurance, we would use that for labs, imaging, prescriptions, if you ever needed PT or OT, things like that. But the way we set up our practice is 2 different monthly plans. Plan number 1, $28 a month, $50 a visit. Plan
Wild.
number 2, I know, wild.
Wild, because direct primary care, is that what this is called?
Direct primary care.
That's only for the rich and famous, is what I thought.
It can be.
I'm neither of those yet. So let's go.
So we're making this direct to consumer, let's put it that way. And like Kim brought up, the aspect that we're completely mobile, so it takes away infrastructure. It makes it really convenient whether I see Kim at her house or her office, or if she's on the road and she says, Dr. Nate, I'm not feeling too good, but I'm all the way in wherever. We have telemedicine services available and take care of things really promptly and get results. That's what we're here for. I was going to say too, the other plan is $148 a month, and that would be zero cost to any visits. The plans cover yourself, your spouse or partner, if applicable, kids under the age of 26, if applicable.
That's right. Okay. And another fascinating thing that I learned is the story behind this. So how did you come up with this particular model that's so affordable?
Got it.
How?
So we wanted to have fun being doctors. Let's start with that. But also have fun and get results. Because at the end of the day, somebody's coming to me because they have a need or a goal or a desire, right? Mm-hmm. So myself and my associate, Dr. Jade Riley, we took about 9 months, 10 months to actually put all this stuff together. There was a lot of intention. There was a lot of research in saying what works really well and we want to apply that, or what didn't work really well over here, we want to avoid that. And of course, we're always evolving, everybody is, but we've got a really, really fun model here that seems to work really well, gets great results.
No office.
No office.
What can you offer in terms of services and modalities?
Excellent. Okay. So at the end of the day, we are primary care, but we are also naturopathic medical doctors. So what that means is I'm trained and licensed to do the conventional things like the pharmaceuticals, okay? But we're also trained and licensed to do the evidence-based alternatives. So the way I describe it, Kim, is we've got a really big toolkit, and we're focused not just on treating the symptoms, but why are these symptoms happening? Or the other side is preventive medicine. If you're on the road a lot performing, you don't have time to get sick. That's your job. That's your That's your economy. That's your passion, all that stuff. So let's prevent those things from even happening. And preventative medicine is truly a huge part of what we do. So when it comes down to, like you said, what do we do in terms of modalities? Sure, we've got prescriptions. Of course, it's through your local pharmacy, but also botanical medicine, acupuncture, cupping. We do a lot of really fun stuff.
Yeah, and the very first visit, he took my blood pressure, checked everything just in my home. He has all the kits. I don't know if that's an every time thing.
Pretty much, we try to keep vitals consistent. And the other thing, too, I know I brought up insurance, but a lot of folks don't have insurance.
Yeah.
So we have access to cash-based labs and imaging in the Valley that makes getting services done actually really affordable. Like routine blood work, sometimes people don't want to see a doctor because they think the cost is going to be the prohibitive factor, right?
Right.
But routine blood work, cash-based prices around the Valley, we can get that for around $35, which is tremendously affordable.
I didn't even use insurance for my blood draw, and I think it was 50 something for the whole thing.
Not bad.
Yeah, that's great.
Not bad.
I didn't even want the hassle. I was just like, let's
just go for
cash. Yeah. So another question. You talked about making this sustainable for you as a physician and then also for your clients, patients. How many patients are you wanting to have?
So we're capping it. We want to focus on quality and not just have this grow and get other people involved, and then it becomes a whole big thing. That's not what we want to do. We want to be specialized in that way. So we're capping it at 500 patients.
Okay.
And of course, that's an ebb and flow, of life, right? Some people go literally and metaphorically. But that's our goal, because we do want to be able to say, you need to see a doctor. Well, we can do that tomorrow, and not 2 weeks down the road, I can maybe see you.
Right, and you're wanting your patients to also come back. So it's not a one-time thing. You want to be able to see us for the next 40 years and develop that relationship. And you can't do that when there's so many patients, not enough time.
Right. And you're seeing the same provider consistently. So there's a lot to be said about that, where I know your past history, and it's not just a new face every time I see somebody. So I can go back on that history, or what did we talk about, Kim? Oh, yeah, this happened before. What worked, and pull that out. It's all about developing a health relationship, and building on that, because without your health is your wealth.
Yes.
So that's what we're all about.
Yeah. I've already seen him 3 times, and we'll be seeing each other forever.
I appreciate it.
You know too much at this point, so don't want too many people knowing everything.
Doctor-patient confidentiality. There you go.
That's right. Okay, last question. How do we get a hold of you, and how does that work?
Really straightforward. So you can visit our website, www.swintegrativemed.com. I'm sure you can put this link on the page.
Is it SWIMA.com or no? Will we spell it out? Okay.
No. So SW abbreviated for Southwest.
Okay.
Integrativemed.com, because we're SIMA, Southwest Integrative Medical Associates.
Okay.
Yeah. So our website has all of our information, including new patient forms, a little bit more information just about our practice philosophy and some of the additional things that we do. To make an appointment, call, text, email. Please, it's very straightforward.
Yeah, you can text him. It works. He replies. Better texter than I am. So thank you so much for talking with us. Yes, the musician community is small, tight-knit. We need as many resources as we can get that are helpful. And if it is, I want to talk about it. So far, this studio and what I'm doing is just good ideas. So anything that I think is a good idea is going to be presented. So thank you so much for being here.